Chapter 12, Thinking Ahead, Student Selected Components, Careers and Electives. Overview. This chapter provides an overview of some of the choices that you will need to make during your time at medical school that might affect your future career. There are some themes running through this chapter. These include consciously planning activities in order to inform your future career choices, being careful not to narrow your options too quickly, and re-evaluating your career knowledge and career position often. As always, curiosity will serve you well. You will have a lot to learn from others, even if theirs is not your preferred career. The hardest message is that you should expect some disappointments along the way. Things don't always turn out the way you expected on day one. Often, students' childhood dreams of being a psychiatrist or pediatrician or whatever crumble to dust during clinical attachments in those specialties. Their aim, therefore, should not be to stick to one choice, but should be to make sure that things will turn out well and that your career is guided more by active choices and less by chance. Careers in medicine. There are whole textbooks written about careers in medicine, whole departments of faculty employed to advise you. We are not intending to replace these valuable resources. Indeed, medical careers are currently very much in flux and are likely to remain that way for some time to come. The older systems of slowly advancing and then waiting around for the consultant or general practice partnership that you were going to keep for life are gone, and in its place is a fast-track run-through system, which will probably result in specialists changing jobs far more often than previously. These fast-track programs require early decisions about careers. You will be expected in your foundation years to be making some decisions about where you want to end up 5 or 7 years later. This causes much stress to many. You can minimize this stress by being strategic at medical school and building a portfolio of experiences that will guide you to the areas that you are interested in pursuing and the areas that really don't do it for you. The current blurb for the fast track systems is that there will be little flexibility. They will run like efficient conveyor belts, with FY two doctors joining at the bottom and falling off the top as specialists. In reality, of course, humans are messy. They get sick, get pregnant, they go off abroad for a year, emigrate halfway through their training, or have even been known to change their minds halfway through training as to their preferred career. Any system will need to adapt to this messiness, will need to become organic, even if this is not evident in the formal planning. In other words, there will always be second chances. You should see it as one of your main jobs at medical school from day one to be curious about other people's careers. Ask every clinician you meet the story of how they reached their current position. Ask them what the best bit and the worst bit of their job is. You might not want to do gynecology for a career, but you can still learn a lot from the career path and choices that a gynecologist made. When did they know that that career was for them? Did they take any career gaps? How did they know that they were ready to be a consultant? If you discover that everyone who you respect spent time abroad, for example, then you might feel more tempted to build that into your career plan as well. I don't know what kind of doctor I want to be. I'm really looking forward to the next few years and getting a real flavor of the range of options I have. Josh, first year medical student. Try and engage with all the medical specialties that you are connected to as a student, and if you miss out on some, think of ways of finding out about them. One way is through arranging student selected components as discussed in the next section, but there are other options too. Talk to students who have been attached to those specialties. Perhaps during some spare time you could hang around on their wards and see if you can shadow the junior doctors, ask to sit in on clinic or to go to the departmental meetings or training. Some students feel awkward approaching clinicians to ask about careers. If this includes you, try the following exercise. Exercise. Imagine that you are a specialist in one of the smaller specialties, let's say tropical neurology. You have spent your life pursuing this specialty. It is your vocation and your passion. Your one regret is that the medical school doesn't recognize its importance enough for it to be included on the medical student rotations. A medical student contacts you asking if he or she can meet with you to ask about tropical neurology as a career. How do you respond? Student selected components, modules. Thanks to the GMC, almost every medical school curriculum in the UK comprises core material and optional components. These optional components, called different things in different institutions, commonly SSC or SSM, usually last for 4 continuous weeks, sometimes lasting a half day or a day a week for 10 or 5 weeks. They are supposed to be opportunities to investigate a topic in more depth. You might, for example, have an SSC in embryology or hematology or sexual health. These SSCs will occur throughout your years at medical school, with some having a predominantly academic slant, others being more clinically focused. Within all this diversity, there are principally two types of SSC: formal ones and self-arranged ones. Off-the-shelf student-selected components. Most SSCs are offered as formal, school-arranged, off-the-shelf affairs where you read the description and put your name down. Usually there is some system of allocation that seems reasonably fair if you get your first choice and terribly unfair when you don't. When you look through the options, students commonly choose depending on interest, likelihood of getting their choice, ease of the course, and suspected grade. You might want to also add into this equation some thoughts about career. If you have always wanted to be a pediatrician since as early as you can remember, then perhaps an early SSC in pediatrics will be useful to see whether it is what you really expected. If you think that an academic career in research will be for you, then how about an SSM that involves some sort of research? Perhaps you will discover that you hate statistics or academic writing is not for you. Better to find these things out early. If you can't decide between obstetrics and gynecology or pathology as a career, an SSC in each in your first couple years will give you more information to help you decide. Self-arranged student-selected components. Self-arranged SSCs can be particularly fruitful in helping you with career choices. The most important person here is the SSC officer, coordinator, administrator in the student office. This is someone to build a relationship with as they will know the regulations and the loopholes. Let's say that you are interested in pediatric surgery and yet there is no formal attachment or pre-existing SSC in that specialty. Most medical schools will allow you to arrange your own either at your home hospital or further abroad, so long as you follow certain rules. Test these in advance and piece together a proposal. You might want to send some emails off to pediatric surgery departments asking about the possibility of an attachment. Or you might want to talk to the SSC officer at your institution. He or she might know of other students who did a really good attachment with a certain surgeon. Great students are those who are proactive. Many of the situations students face, whether they are academic or personal, can be resolved or managed, though are often left until they become unnecessarily difficult and complicated. Students need to view approaching the student office as not a sign of their failure to achieve as an individual, but rather as taking a responsible and professional approach to managing their education, which in turn are both key qualities which should resonate throughout their future careers. Mr. Roberts brought Barts in the London. Cheek and charm are essential when arranging your own SSCs. This includes expressing your enthusiasm, commitment, and good organization when you are trying to arrange it, during it, and after. The period after the SSM is particularly important. Write a brief, honest, but constructive report and put it in your portfolio. Send a copy to the person who supervised you and consider keeping in touch with them. Perhaps an email every term updating them on your progress. They might be a useful contact in the future for references, summer jobs, or careers advice. Importantly, also send a copy of the report to the SSM officer, thanking them for the help that they gave you in organizing it. If you have arranged an SSM abroad, think about bringing back something local and inexpensive for the student office and let them know how it went. Next time you want to build your own SSC, the student office will know that you are the sort of student who will make the most of it, and they are more likely to put themselves out to help. When second best is good enough, it will happen more than once that you will be denied your first choice of SSC or even of clinical rotation. Rather than that pediatrics SSC that she was hoping for, student finds herself trapped in a general practice SSC. Ironically, student B is in the opposite situation. They tried to change, but realized that if they pushed it much further, they would fall out with the student office. So they decide to make the most of it. Some students in this situation will do the minimum necessary to pass the SSC and spend most of their time elsewhere, either in body or spirit. We would advise one of two other routes. The first thing you could try is to throw yourself into this specialty, which was not your first choice. If you want to be a good hospital based pediatrician, you will need to understand how general practice works pretty well. How else can you refer patients back for follow up from their GP? In fact, it is hard to think of any specialty that does not require a clear understanding of other specialties. Indeed, things often fall apart when this is missing. So, your first option is to throw yourself into the SSC and see what you can get out of it. You never know, you might even realize that you had some misconceptions about the subject and it is more interesting than you thought. Much as you might hate gastroenterology, you will see countless patients with bowel problems and need to explain endoscopy to hundreds of patients and probably a few simulated patients in exams. So, an attachment in gastroenterology might be fruitful after all. Your second option is to negotiate for a modification of the SSM. In our example above, where student wanted a pediatrics attachment and got a GP attachment. She could ask to be involved with baby clinics, school visits, perhaps a young person's asthma clinic. Student B, who wanted an attachment in general practice but ended up with the pediatricians, could ask to do some community pediatrics clinics, outpatient clinics, perhaps do baby checks with the pediatric or obstetric senior house officer. Student A learns about pediatrics in general practice. Student B learns some important skills for general practice within a pediatric attachment. Remember, especially if people agree to bend the rules for you, to show that you are grateful for the opportunities that come your way. Electives. Tradition has it that medical students spend some time away, usually in their final year, to study in another institution for a prolonged period. Most students choose somewhere exotic and combine study with travel and immersion in a different culture. Some students stay home, arranging attachments where they will be with a team long enough to take some responsibility and see practice in more depth than they ever had time to as a medical student. Your school will provide support and guidance and even some rules about arranging electives, and you should take full advantage of this along with previous students' elective reports, and you will even find some books on electives abroad. Choosing an elective. Before choosing a country or even a specialty, you might want to stop and think about what you want to get out of this period. Spend some time deciding on what the goals of the elective are. Be honest with yourself. You don't need to share this list of goals with anyone else, not before editing it. It might be that you are considering a career in nuclear medicine and you want to spend the time shadowing a nuclear medicine consultant to be sure that you know what they really do. Perhaps you are sure that you want to be an HIV physician and an opportunity to work in an HIV hospice in a developing country will help you recognize late complications of the disease. Rarely seen now in the UK and also won't do your job applications any harm. You may, however, have more personal goals in mind. Perhaps this will be your first time distant from home, and for some it will be a chance to explore something about themselves as well as a different country. For others, it might be an opportunity to finally lay some demons from the past to rest. What better place to do this than trekking across the Himalayas? Once you have set some goals, the possible locations become easier to choose. You will need to keep your options fairly broad so that you have multiple layers of suitable backup plans. But be reassured that by this stage in your career, you will be highly skilled at gathering information. Just don't forget to talk to the others who might have been there before and look at some books as well as the Google searches. Probably the most important thing for an elective is your supervisor. Finding the right supervisor, someone who is enthusiastic, will welcome you and provide guidance, and mentoring will make a major difference to your experience, regardless of whether you are in Guatemala or Southend-on-Sea. Speak to others who have worked with the same supervisor, look for recommendations and personal contacts of faculty, and see what sort of relationship you can build by email. Ethical considerations. If you are traveling far afield, you might need to pay particular attention to any ethical issues of your trip. If you are traveling to a medically under-resourced population, for example, and are likely to be given a great deal of autonomy and responsibility without support and supervision, then there are clear ethical issues. You might be able to find another institution in the same country where you will have better supervision. Similarly, if you are starting or involved with a project while abroad, perhaps providing healthcare or training, think about what will happen when you leave. It might be better not to start something that cannot be sustained. There often are not clear rights and wrongs, but it is important that you consider the implications of your elective and that you talk this through with your peers and tutors. In years to come, this is a time to look back on with fond memories, not tinged with regret. I went on elective to a small hospital in Africa thinking that I would have a fantastic experience. It turned out that sometimes I was the only medical person available, and I ended up having more responsibility than I could cope with. I'm not sure that it was the experience that I had hoped for. James, newly qualified doctor. Funding. You might be surprised at the range of funding opportunities for electives. If you are performing a specific project or if there is a significant level of personal development, funders are likely to be interested in supporting you. Speak to your student office about funding possibilities and even consider alternative sources such as industry, charities, and professional bodies. This might be a good opportunity to learn how to write funding applications. And remember, if you don't ask, you won't get. Little harm in sending an enthusiastic letter or two out to potential funders. Culture. Max Chevalier is an educationalist working with non-governmental organizations setting up rehabilitation training centers in post-conflict countries. As part of his unpublished master's thesis, he conducted a qualitative analysis of the experiences and perceptions of Dutch physiotherapists who traveled to developing countries on elective. Some students returned home enriched by the experience, valuing having been part of a different culture and gaining a huge amount of respect for healthcare workers working in low resource settings. Whereas other students returned with negative experiences, often with rather deep seated prejudices that seemed to have developed while away. It was hard to find reliable predictors of a good outcome, but the following factors seemed helpful. Having a good relationship with their supervisor or others who had worked or lived in the host country, having personal traits and approaches such as flexibility, non-judgmental approach, empathy, knowing something about the country before you go, knowing some of the local language, traveling in a pair valued by many students so that they had some safe space in which to reflect on things that had happened, although some felt that this prevented them from engaging with local culture. Aside from the supervisor, curiosity seems to be an important attribute for a positive outcome. Most students had a negative encounter of one sort or another, a supervisor shouting at them, for example. Those who, after enough time had passed for things to calm down, approached their supervisor and asked for help in understanding what they had done to cause offense, tended to have much better outcomes than those who withdrew. In Chapter 4, we discuss feedback in more depth. The same rules apply here, describe behaviors, and try to avoid making premature judgments about meaning. Michael Page and colleagues have written a nice book, principally aimed at Americans studying abroad, which covers aspects of culture and cultural adaptation well. Your medical school library might have a copy of this or something similar. You can buy this book yourself directly from the University of Minnesota website. Balance. Most students use the elective period to explore another country or culture, and round the world tickets are popular. Don't forget that this is also an opportunity to explore a career in much more depth than you would usually be able to, and to explore the possibility of working in a different country. Both of these opportunities are unlikely to ever be repeated, so make good use of them. Review your goals often, negotiate with your supervisor, and make sure that they know where you are. If you have chosen your supervisor well, they will understand the need for you to take long weekends away from time to time. Clearly, if you see your elective as just a holiday period, not only will you be losing out on a valuable experience, but you will also run the risk of failing to reach an adequate assessment, which might lead to difficulties back home. Follow up. Consider keeping a diary, or how about a blog? Many blogs allow you to email or even text entries, which will make access easier if you are traveling or if internet access is slow or intermittent. This will allow you to keep a record of events and reflections and might keep those at home reassured that things are going well. Write up a report when you are on the way home. mentioning experiences good and bad, and add useful context details. Think about what advice you would have found useful before going and write that in. You might want to include some personal reflections, or you might prefer to keep them for yourself. It's still worth writing them down. Send thank you letters to everyone and anyone involved, including a copy of the report. Some will read it, others won't, but it is likely that they will appreciate your thanks. If stressful things have happened on the elective, think about discussing these with others, either your friends or more formally with your tutors. You might want to think how you will make it easy for your colleagues to talk to you if they have had difficult experiences on elective. Summary: we have tried in this chapter to suggest that right from the start of your time at medical school, you consider a career angle on everything you do without being career driven or being single minded in your thinking. You will have a lot to learn from all your clinical attachments that will help your future career, regardless of what specialty you will follow, but only so long as you see each of these attachments as an opportunity.